Hi there. My name is Gayatri Devi, and I'm founder and director of Park Avenue Neurology in New York City. I've been working in the area of memory and cognitive disorders since 1994, and today I wanted to share with you some tips for maintaining confidence when there's been a diagnosis of Alzheimer's disease, dementia of some sort, whether it's dementia from vascular disease or Lewy body disease, or even mild cognitive impairment, and how to maintain the confidence whether you've been given the diagnosis or whether someone you know and love has been given the diagnosis. Because confidence is one of the most crucial characteristics that is important for human interaction, that allows us to maintain relationships and be acknowledged as a contributing member of society. So when that confidence is diminished, which often happens in my patients who have a diagnosis of Alzheimer's, it can be very impactful on their ability to function. The most dramatic example I have of this is a patient of mine who was misdiagnosed for 5 years with Alzheimer's disease. It turned out she didn't have Alzheimer's at all. She had another kind of neurologic problem, does not interfere with her cognition. But during those 5 years, both she and her husband made the mistake of telling their friends and family about her diagnosis. And over the 5 years, she was just diminished. She was no longer participating. She used to be a vibrant society hostess. She was no longer doing that. People would talk around her and about her, in front of her. And she herself, being a very proud and sensitive person, just lost a sense of herself and really wouldn't contribute to society and conversations in the way she was used to. And after a diagnosis was made that was the accurate one, she still was not able to reestablish herself in her circle of friends or in her family, because her fall from grace, as it were, had been too bruising a fall. So in order to prevent those kinds of consequences, there are some simple things you can do. First of all, if a person who has cognitive disorders makes a mistake or an error, don't correct unless you absolutely have to. When someone who doesn't have cognitive problems, you or I, make a mistake and someone corrects us, it either makes us feel diminished, or we learn from it, or we get angry with the other person. If we're really convinced that we are correct, then we get very upset with the other person. If we're not sure and we're not quite confident about our thinking, then the correction makes us feel less adequate. So my premise has always been, don't correct unless you absolutely have to. So if I were to say to you, I went out to the movies yesterday, and you know for a fact that I went to the movies 4 days ago, unless it was absolutely necessary for you to correct me, don't correct. Number two, in order to maintain confidence in my patients with Alzheimer's, what I will often do is admit my own errors and mistakes. So sometimes when I forget something or I can't recall something, I will say to my patient, oh my God, I just forgot that. My memory is not good. And that, interestingly, levels the playing field even for a little bit. And that's a good thing, I think, in these situations, because we all forget. Forgetting is a common and incessant and normal part of living. And so to acknowledge that makes the other person feel less isolated, regardless of whether they have a diagnosis or not. The third thing that I think, which is very important in maintaining confidence, is to keep the person engaged in the conversation. So even if I'm speaking to a person with Alzheimer's disease and the family member is with the person, and the patient with Alzheimer's may be very forgetful, I will still say to the patient, I think we should try this medication to help your brain stay healthy. And then I might turn to the caregiver and say, this is the name of the medication. and this is what we are going to do. And then I turn back to the patient and say, there are some side effects, but really be very inclusive so that this is about the person with the condition, and to include them in the conversation I think is very important. And this is also true in daily conversations, whether you're out for dinner, just include the person, because it's surprising how often that doesn't happen. Another important piece of information is don't put the person on the spot. None of us like to get put on the spot. And in people who have cognitive disorders, sometimes well-meaning family or friends might say, well, look, she doesn't remember the anniversary of our wedding, or she can't remember the birthday of our grandchild, or he doesn't remember the name of his college that he graduated from. And then they'll turn to the person and say, tell us the name, or tell me the date. And the other person gets very flustered. And that is, I think, particularly disempowering. I think particularly humiliating in a funny way, which I know the family doesn't mean that. And I know that the person doing the questioning doesn't necessarily mean that. They're proving a point. But in the proving of the point, the ego of the person gets very damaged in that particular interaction. So I try not to put the person on the spot where their deficiencies are highlighted. On the other hand, it's something that I love doing is if I know that the person was very good at something, say they're very good at remembering opera singers, or they're very good at medicine, even a physician or a lawyer, I will ask them questions in their field that I might need advice on. So for example, I had a patient who was a very world-renowned psychiatrist and fantastic family therapist and known for all his work and research in the field. And I remember I was once having a problem years ago when I was much younger in my practice with a particular patient, and I was going to send this patient a letter. And so I thought, I'm going to ask my patient with Alzheimer's what he thinks. So I said to my patient, I said, Dr. blank blank, what's your opinion? And he said to me, he said, listen, in a situation like this, pick up the phone and call your patient. Don't write him a letter. So that's exactly what I did. I picked up the phone and I called the patient and we resolved the problem. And I learned something then, which is usually it's much better to interact by in person or by telephone rather than by text, particularly when you're angry, or by email. I have another patient who's a great event coordinator, and subsequently he's not working because of his cognitive impairment, but he's good with the gestalt of things. And recently I was having trouble with figuring out if I wanted to really give a talk that was being asked of me. And I said to him, I said, what do you think? And he asked me all these questions. He's like, how important is this talk to you? What is the message you're trying to convey? Who's the audience? And he just made me think about the whole thing in a very productive way that was helpful to me. So there I got advice from another patient who was suffering from Alzheimer's disease. So the idea is to look and receive this type of advice, because then it makes the person feel useful. But it also was very useful for me. So I wasn't just doing it just to make the person feel better. I was consciously asking them about the solution to a problem that I was not able to come up with the answer to. So that's another way to acknowledge the gifts that that person has. Another important thing to remember is just because someone is not doing well in one area, it doesn't mean they're not doing well in other areas. So for example, just because I'm not good with directions doesn't mean I'm a bad driver. So some people with cognitive impairment may not have the ability to get from point A to point B, but they may be very good drivers, and they may need to be able to drive to maintain their sense of independence. But because we tend to group functioning in many areas together, we tend to clump it together. We say, oh, he or she's not good with directions, therefore they're not good with driving. So don't throw the baby out with the bathwater. Look at exactly what function is perhaps undermined, and then focus only on bolstering that function, but not to remove the person's ability to resort to working in other areas. The other important thing that I think it's important that I think is necessary to remember is anytime you're dealing with any illness, there's a balance between safety and quality of life. You can choose to be extremely safe at great expense to quality of life. So, for example, if I'm to get dementia, I'm somebody who loves to walk, and I like to walk by myself in different areas, and it gives me a great sense of joy. Now, my family may be concerned that I could be lost, that I could get hurt, and so they may not want me to walk by myself, but walking by myself is something I truly enjoy. So how do you balance this? And sometimes that's important to remember, is what's the quality of life cost versus the safety cost. And so with patients who are constantly being surveilled, as it were, patients with Alzheimer's and other cognitive disorders, I sometimes think of as living in a goldfish bowl. Everybody's watching them to see, is he or she making a mistake? What are they doing? So I know that if I'm being watched like that, I'm going to get nervous, I'm going to make mistakes. So that in someone who is in that kind of a pressure cooker type situation, it's a very hard thing to be managed, in all aspects of one's life. So I think a little bit of independence in those situations is a good thing. So for someone like me who loves to walk, perhaps you'd want to give me a bracelet that has my name and address on it, so that if I do go out for a walk and I do get lost, someone's going to be able to bring me home. So those are important things, again, to remember, is don't correct unless it's absolutely necessary. Include the person in the conversation, and admit your own mistakes and lapses, because it makes the other person feel less like they are impaired. Don't put the other person on the spot, but if you can put them on, highlight some of their strengths. For example, I will sometimes say to a patient, oh my goodness, tell me what the name of that singer is again that we're hearing. And the person will say, oh, that's Alanis Morissette, that's Tony Bennett. And I say, oh yeah, you remember, what's that song? And they'll tell me what the song is. And I may not remember, but they have a good mental repertoire in this area. And I'll say to them, wow, your memory is pretty good there. And that is a good way of acknowledging that just because memory is not good in some areas doesn't mean it's bad in other areas. So again, you look for different areas to bolster the person's confidence. And in this way, you can help yourself be a better caregiver, or if you're the person suffering from cognitive impairment, understand all these concepts, because you realize that the brain is a very complex organ, and loss of function in one area or even in one aspect of one area doesn't make us incompetent. It just makes us more nuanced, more challenging, more human. Thank you very much.